Good morning, Trinidad and Tobago. I hope you all had a truly happy Independence Day. And as you'll see, we are all still rocking our national colors because we are celebrating Trinidad and Tobago and encouraging everyone to be vaccinated. It's my absolute pleasure to be here at the Ministry of Health's virtual media conference on the national COVID-19 response with these expert panelists this morning. Some of the faces you know and one new expert face today. We have Dr. Miriam Richards, Principal Medical Officer, the Ministry of Health, Dr. Adish Sujisingh, Director of Women's Health at the Ministry of Health, and our new face today, very experienced but new face, Dr. Farah Suleiman. She's an ICU specialist, a medical doctor, and she has a special testimony for us here this morning. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator this morning. First to address you is Dr. Richards, who will provide the clinical update and information on the parallel healthcare system and give us some insight into occupancy levels. As you know, that's a very critical indicator for where we are at here in Trinidad and Tobago as it relates to COVID-19. We go to Dr. Richards.
Thank you very much, Candice. Good morning to my colleagues, Ms. Candice Alcantara, Dr. Sujisingh, and a special welcome to Dr. Suleiman. Good morning to all members of the media who continue to join us at our weekly press conferences, both here and when we host with the Prime Minister's office. And good morning to the viewing and listening population of Trinidad and Tobago. Happy Independence Day to all. We are now 59 years old as a country. This morning, I'd like to provide two updates. I'll start with the media release update as of 4 p.m. on the 31st of August 2021, and that's media release 833. And I'd also like to present an update on the status of the facilities in the parallel healthcare system. So as of 4 p.m. on the 31st of August 2021, there were an additional 241 confirmed new positive cases. And this took the rolling average to 209, and we've been seeing the rolling average within that sort of vicinity for possibly over 2 months now, somewhere in and around the 200 range. This has taken the total number of active positive cases to 4,404. And these cases are broken down as follows: 3,777 persons in home self-isolation, 284 persons in the 9 hospitals within the parallel healthcare system, and 102 persons in step-down facilities. At present, there have been 1,291 deaths, and our sincere condolences to the family members of the deceased. I'd also like to touch on the vaccination update, and as of 4 p.m. yesterday, there were 509,516 persons that have been vaccinated with the first dose of a 2-dose regime. In terms of persons who have completed vaccinations, and that is persons who have been vaccinated with a second dose of a 2-dose regime, this number is at 397,340. 1,776 persons have been fully vaccinated under a single-dose regime, and that's the Johnson & Johnson vaccine that was recently introduced. And 399,116 persons in total can be considered fully vaccinated with any one of the choices that are currently available to the population. I'd like to now move on to the summary update of the parallel healthcare system, and that would include 16 facilities with a bed capacity of 1,022. And I'll start by just introducing yet again the graph with the rolling average. And we would notice, as I had indicated earlier on, and as Dr. Hines reminds us, that we have been on or around a rolling average of 200 since sometime in June. We did see an increase over the last few days that took us just over to 200. And at present, the rolling average is 215, up from 209. Next. This slide really just looks at the difference between admissions and discharges and helps us to predict the potential increase in patients and the increased burden on the parallel healthcare system. And there was a slight increase in terms of the gap between admissions and discharges over the next 2 days. However, our week and our reporting week has just started, and between yesterday and this morning, there were 5 additional persons being added into the parallel healthcare system. So we had a net admission over the last day of 5 persons. The other slide really would show a breakdown, and it's important to note that our week has just started. So if you see a decrease in terms of the blue and the green bars, the blue being admissions and the green being discharges, is because we've just started the last week and this week. And you'd notice that admissions continue to exceed discharges, meaning that we now have additional patients, as we have been noticing since April 20th or so, being added into the parallel healthcare system. The other slide shows the actual numbers of additional patients. And even though we are halfway into the week, we are almost at the same number of additional patients, 48 versus the total for last week, 56. So we anticipate that this week, by the end of this week, we will have more patients as compared to last week. Another factor that we choose to include, which is shown in the following slide, is the total number of COVID positive patients, because that gives us an idea of the actual usage of the system. And as of 8 a.m. this morning, there were 374 persons being managed in the parallel healthcare system. Of that 374 persons, 275 are in the 9 hospitals under the parallel healthcare system and 99 in the step-down facilities. We also have 10 children, and of course we remember the legal definition of children being persons under the age of 18 within the parallel healthcare system receiving medical attention. We of course look at occupancy as in the next slide as a measure of how the parallel system can adapt and accommodate persons, and the occupancy today is at 37%, a trend which we have been noticing since July 15th. If we broke up the occupancy, as this next slide indicates, between Trinidad and Tobago, Trinidad is at an occupancy level of 36%, while Tobago is at 42%, meaning on average 4 out of 10 beds in each island are currently filled managing COVID patients. We also look at the average weekly percentage occupancy, and in this slide we notice a similar trend in that the Augustus Long Hospital continues to be the only hospital that is above the critical threshold of 75%. The hospital is at 92% occupancy this morning, but all step-down facilities which aren't represented here are under that critical factor. And the last slide that I would be looking at, or second to last slide, would be a discussion on the occupancy across levels of care. And this is integral, especially given the context of vaccines that are available in the population. At present, the ward level percentages, ward occupancy, which deals with the least ill patients in the system, is at 37%. Whereas with respect to ICU and HDU, ICU occupancy is at 82% and HDU occupancy is at 20%. The Chief Medical Officer on Monday would have shared with the population the statistics regarding vaccination. Vaccines are now safe, available and accessible at 109 health centers and mass vaccination sites run by the RHA and run by the private sector. And he would have shared that at present, 98% of persons since the 27th of July to present in the HDU department were not fully vaccinated. 99% of persons being admitted to the ICU department have not been fully vaccinated. And 99% of deaths from May 9th, 2021 to present are persons who were not fully vaccinated. This means, and this can be interpreted as vaccines being a life-saving tool for persons and to prevent them from being hospitalized from COVID-19. The last slide that I would share with you this morning shows the status in our accident and emergencies. which continue to have a low number of persons being transferred to the parallel healthcare system. And in closing this morning, we would like to thank every single member of the population for continuing to comply and to be responsible by following the 3Ws. We also thank you for following the public health regulations. However, we need you to take a greater level of social and personal responsibility. And, given that we just had Independence Day, civic responsibility. And let us please all ensure that we are vaccinated. Vaccines are safe, they are effective, and they are accessible. The Johnson & Johnson vaccine is now available at all of our sites. The Pfizer vaccine is available for children and young persons between the ages of 12 to 18, as well as healthcare workers and teachers and persons who are considered essential frontline. Vaccines prevent avoidable deaths. Vaccines prevent avoidable ICU and HDU admissions and prevent our healthcare system from being overrun. Vaccines save lives. Thank you very much, Candice.
Thank you very much, Dr. Richards. Vaccines save lives. And as Dr. Richards mentioned, Trinidad and Tobago is quite blessed to have a range of vaccines available, and vaccines that are available for persons 12 and over. And of course, the Pfizer vaccine is also approved for use in certain categories of pregnant women. And we have the Director of Women's Health with us here, Dr. Sujisingh, who will provide an update on vaccination for that category of persons.
Okay. Good morning, and thank you, Ms. Alcantara. Good morning, Dr. Miriam Abdul Richards, and good morning to Dr. Suleiman, who is joining us today. Good morning to, of course, members of the media and to the viewing and listening public. So I was here approximately a week ago, and I would have announced the rollout and the approvals for the Pfizer vaccination program in pregnant women, and there were several questions being asked on the media for the past week, and I'm here to just give an update on this. So the first slide, again, who I am. I represent the Ministry of Health. I'm a medical doctor for the past 31 years and a specialist in obstetrics and gynecology as well as administration. So I'm providing technical advice, learned advice, research advice to the general public. Next slide, please. So this is an interesting figure. On this slide, we have now, as of Monday, 383 pregnant women in our database who have contracted COVID-19. And I was here just a week ago, and that figure was 315. So an additional 68 women, for my calculation, would have contracted COVID-19 since we last spoke. And that is very alarming. And that's really why I'm back here today, to appeal to the population in general to get vaccinated, and also for pregnant women to hear the message that we are trying to say today. The numbers are rising. Pregnancy, of course, is considered a high-risk situation. You are more likely to end up getting very ill, ending up in an ICU, and worldwide we have seen maternal deaths. Next slide, please. So, just an update again. From the end of June 2021, we would have approved initially the use of the Sinopharm vaccine in breastfeeding population. So if you are going to get vaccinated and you happen to be breastfeeding, you can safely receive the Sinopharm vaccine, and that program is rolling out. As of last week, Wednesday, we started the new program for pregnant patients in the second trimester and above to receive the Pfizer BioNTech vaccine. Next slide. So we provided this information last week, but I just want to remind the population it was recommended based on a very high level scientific discussion with members of the World Health Organization based in Washington. And we approved the use of the Pfizer vaccine for pregnant women, regardless of nationality, after you've completed the first trimester. So from week 13, you can be vaccinated. the program remains voluntary, but we highly recommend vaccination as the most important public health measure available to us to help us get out of this pandemic. For pregnant women, it has to be based on advice from your healthcare provider. For the first dose, simply get a letter from your healthcare provider, be it your midwife, the nurse in your clinic, your medical doctor in the private practice, the public healthcare system. Just confirm that you are pregnant, that you've had a discussion, of course, with your doctor or nurse, and that you have crossed into 13 weeks and beyond. We also made it simpler as well. We created a new form, and in the public healthcare system, this form is already printed to make this process very easy. Walk with your identification when you visit the sites. Next slide. So these slides, these are the existing mass vaccination sites for Pfizer, which are on, you can get this information, which is updated on a regular basis on the Ministry of Health's website. There you can get updated information. Please check to see the site that's closest to your area. I'm pleased to say as well, Tobago has also rolled this program out as well, so it's available in Tobago. Now, phase 2 is actually started in some of the regional health authorities. Phase 1 was at the mass vaccination sites, but we are trying to get the vaccines in the major antenatal clinics, so easy access. You should be able to, I know Eastern Region Health Authority would have started this week. We are also targeting the postnatal wards in some of the RHAs, and this includes use of the Sinopharm for the breastfeeding mothers, as well as the Pfizer vaccination. Next slide. Now, why vaccinate pregnant women? I know there are a number of social media experts busily commenting on the live feeds as we speak, who are giving advice, but the best way to protect yourself, this is really for both for pregnant women and for whole of society, as Dr. Mariam Abdul Richards just said, and it protects those around you as well. We said COVID-19 is serious in pregnancy. It's not to be taken lightly. In terms of this vaccine, the mRNA type of vaccine, over 300,000 women have been vaccinated worldwide. When you take the vaccine, it protects your unborn baby as well. Additionally, there is no different side effects other than what we have already stated when you compare a pregnant woman with the general population. Next slide. So in terms of the safety, this vaccine, the mRNA vaccine, lasts in your system for a very brief moment and triggers your immune system, and then is eliminated from your system. The vaccine does not cross the placenta. If you're breastfeeding, the vaccine does not go into the breast milk. The antibodies, however, cross the placenta, and the antibodies are excreted in the breast milk and give your baby some level of protection. We have not seen any adverse pregnancy-related outcomes worldwide, nor here in Trinidad and Tobago. Next slide. So we know for certain if you're pregnant, we are seeing the benefits of the vaccination program worldwide, and we hope to see this in Trinidad and Tobago. Vaccination builds antibodies which we know can cross and give your baby some level of protection when the baby is born. Next slide. So some of you all would have pulled up earlier information which we would have said at that time we were waiting on more data before we allowed vaccination in our pregnant women in Trinidad and Tobago. So this information is updated information. I want to reassure you that the entire process worldwide, as well as in Trinidad and Tobago, is highly regulated. It is continuously monitored and reviewed. If there are any changes, we will get back to you and the population. Next slide, please. So this is my last slide. And so far, for 5 days of data I have collected so far, we've had more than 155 pregnant women. I'm just waiting on some updated numbers from the last day or two, which is a good start. Roughly, we are hoping to get at least 1,000 women who are eligible per month as the program is rolled out. So it's a good start, and I just want to acknowledge two persons, Liana de Kyries, who is listening in. She actually shared her experience at one of the vaccine sites and had a lovely photograph in one of the daily newspapers. We should be hearing more from her and her experience. And the next speaker as well will be sharing some experiences as well. So I turn you back to Candice. Thank you very much.
Thank you so much, Dr. Sujisingh. So you've just heard from the Director of Women's Health. But as you know, women sometimes like to hear from women. We have Dr. Suleiman here with us, and she's just a wonderful combination. A medical doctor who's actually an ICU specialist. And on the flip side of it, she's also pregnant and has been vaccinated herself. So this is a very opportune time for us to hear from her, and we're very thankful that she's taken the time to join us. So let's go to Dr. Suleiman and get her experience and insight into why she decided to take the vaccine.
Thank you, Candice. Good morning, Dr. Richards, Dr. Sujisingh, members of the media and members of the viewing and listening public. I'm Dr. Suleiman. I'm one of the anesthetic and ICU doctors at the Sandy Grande Hospital. I'm also 8 months pregnant, and I received my first dose of the Pfizer vaccine last week. I want to share with you why I decided to take this vaccine and some of the worries I had. Working throughout this wave of the pandemic while being pregnant has been particularly nerve-wracking. Many of my colleagues were vaccinated earlier this year, but I was not because of my pregnancy. Even though I was taking all the precautions, I was constantly worried whether I was exposed to COVID through my interactions with patients or colleagues. I was also worried I could carry the infection home to more vulnerable members of my family, like my parents or my daughter. Then in May of this year, we started seeing younger patients, just like myself, with severe illness, being put on ventilators and some eventually succumbing to COVID. We also saw an increased number of pregnant women testing positive for COVID, some with complications like preterm labor, pneumonia, requiring intensive care, and unfortunately one maternal death. Witnessing this played a role in my decision to get vaccinated. Throughout my pregnancy, I looked for any information I could find on the safety of COVID vaccines from reputable sources. I also sought my doctor's opinion. Initially, I will admit it was overwhelming. There was hardly any information, as pregnant women are not included in vaccine trials. But now this is not the case. The mRNA vaccines, like the Pfizer vaccine, have been widely used for pregnant women in the US and the UK. And there have been no safety concerns. There's no increased risk of miscarriage or stillbirth. The vaccine offers excellent protection to the mother and prevents severe illness. There's also the added benefit of protection to your baby via the mother's antibodies, which cross the placenta and are present in breast milk. With all this information, I was hoping that one of these vaccines would become available in Trinidad. And then with the arrival of the Pfizer vaccine, the decision to offer it to pregnant women, I jumped at the opportunity, and I took it on the first day that it was available. To be honest, what worried me more than any potential vaccine side effects was being infected with COVID, going into preterm labor, ending up on a ventilator, and not being able to come home and care for my children. With this vaccine, this is now a remote possibility. After receiving the vaccine, I experienced no side effects apart from a sore arm. There has been no change in my baby's movements, and at my clinic appointment on Monday, there were no issues. I know there are concerns about the long-term effects, particularly on the baby. But this vaccine is a non-live vaccine, and generally non-live vaccines do not cause long-term effects. And it's broken down quickly, like Dr. Sujisingh said, after injection. And what remains are the antibodies to help you fight infection. Some women may think, why not wait until after delivery to get vaccinated? But there's always a risk of exposure. Through your interactions with your household members, going to clinic appointments, day-to-day errands. And compared to the COVID virus we saw last year, the new variants like Delta are more contagious and are causing more severe disease in pregnant women and children. So there is now more reason than ever to get vaccinated. We are fortunate in Trinidad and Tobago to have access to a wide variety of vaccines. Let us take advantage of this. Looking at what is happening in the US and even Jamaica, we are at a critical turning point where we have the option of reaching a high vaccination rate before the Delta variant takes hold. I got vaccinated to protect myself, my family, my patients, and my colleagues, to visit the beach once again with my children, and to spend Christmas with my loved ones. I encourage you to speak to your healthcare provider about your concerns, and together we can all do our part in getting us back to normal. Thank you.
Thank you very much, Dr. Suleiman. I'm so thankful for your very honest and open communication with us this morning. And I know, ladies, I can tell you, as a female in childbearing age, I'm very comforted, not aware of some of the things that were highlighted today. 300,000 women, I think you said, Dr. Sujisingh, around the world who've already received the vaccine, pregnant women, and all of the information about the antibodies being passed on to the baby. Very, very powerful reasons to take the COVID-19 vaccine. We go into the question and answer segment now. We ask our media representatives, you know the deal. Please indicate your name and the name of the media house that you represent. We ask for no more than 2 questions posed at the same time, so that we'll keep things rolling. Keep your questions brief, please. And if we can, we will come back to accept additional questions from the media. We begin with questions from Newsday this morning.
Good morning, Clint Chantak of Newsday. My questions are to Dr. Richards. First of all, have we expanded our virus surveillance to look at the possibility of the new MU variant possibly reaching us, and do we have any idea as to how effective the vaccines we have are against this particular variant? That's my first question. My second is, we have the bar owners and members of the cinema sector have expressed optimism of wanting to open soon. So given where we are in terms of vaccination and our protocols, is it safe for members of these particular sectors to possibly have some optimism of opening, say, within the next few weeks?
Good morning. Thank you, Clint. So you asked a question, you asked a 2-part question. So I'll start with the first part of the question, which is confirmation of the Ministry of Health's ability to expand in terms of viral surveillance given the new variant and the effectiveness of the available vaccines against the variant. So the Ministry of Health works collaboratively with the University of the West Indies laboratory, and that entire project is led by Dr. Christine Carrington in conjunction with the Dean of the Faculty of Medical Sciences, Professor Simongal. And the Ministry of Health will, once there's a new variant, the required procedures and testing availabilities and kits and so on are made available. This, of course, is a new variant, and we will provide confirmation of when we begin testing for this variant. Secondly, you asked about the effectiveness of the available vaccines against this variant. We continue to be guided by the World Health Organization information and the evidence that is provided by the World Health Organization, and we can confirm that the available vaccines in Trinidad and Tobago, which are all EUL emergency use licensed, approved by the WHO, are all effective against the COVID-19 virus and prevent the infection, the COVID-19 infection. The next part of your question dealt with a more regulatory aspect, and that is the reopening of bars and cinemas. This falls under the purview of the Honorable Prime Minister, as it is a policy decision, and so we will await further information from the Honorable Prime Minister and his team regarding the reopening. Thank you very much.
Thank you very much, Dr. Richards. AZP News, we are ready for your questions now, please.
Hi, good morning. Priya Bihari, AZPnews.com. My first question is for Dr. Richards. Dr. Richards, I wanted to find out what happens to the medical waste at the vaccination sites. How are they disposed of the syringes, the vials, etc. And is there a cost attached to that? And my second question has to do with persons who have had COVID-19 and they're allowed to have the vaccine 3 months after. Can you say when exactly do they start to calculate that 3 months and like how long after is that they're eligible to get the COVID-19 vaccine? Thank you very much.
Thank you very much, Priya. Two very diverse questions. The first question was very operational in nature and excellent question where you were inquiring as to the process for disposal of medical waste. So medical waste is considered biohazard, and of course the Ministry of Health and the RHAs which provide the actual service and the service delivery at these sites and run these sites has systems that have been in place to dispose of medical waste in the appropriate fashion. If you would like further information on the details of the disposal of the medical waste, which we can confirm is done under WHO infection prevention and control practices and is monitored, you are free to contact the actual RHA through their COPCOM department and the relevant chief executive officer. The second question was pertaining to the gap between persons who have acquired the COVID-19 infection and when they can access the vaccine. And the CMO would have indicated that it is currently a 3-month period, and that of course we continue to be guided by ongoing evidence and research from the World Health Organization. So thank you.
Thank you very much again, Dr. Richards. We go now to Guardian Media Limited.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. My first question this morning is to Dr. Sujisingh. Dr. Sujisingh, could you state or let us know if any other vaccines are currently or have been considered for use among pregnant women and breastfeeding women as well? If any considerations are being given right now or have been in the past and the decision was made that no, we won't allow that? And my second question is to Dr. Miriam Abdul-Richards. Dr. Richards, I just want something explained here for me. Before we had a vaccinated population or levels of vaccination going on, it was relatively easy to tell how many hospital spaces we would need. We knew that around 18 to 20% of all infections were requiring hospitalization. But now that we are seeing increasing levels of vaccination within the population, which means less possibility of people having to be hospitalized, how is it that we're going to be making those predictions about, okay, we may need to increase hospital spaces or not? Thank you.
Okay, it's okay. I'll take the first question. Thank you, Rishad. So the question you asked is about use of other vaccines and in use in pregnancy and breastfeeding. So couple months ago when I actually came on this press conference, I did say that we were considering quite a few of the vaccines that were in Trinidad and Tobago, as well as the others that were already approved by the World Health Organization, but we were awaiting data, and of course we were awaiting vaccines on the ground. So last week we actually reached to that point where we had an eligible vaccine, which is the Pfizer vaccine, based on the mRNA technology, which is in fact the vaccine that has been most widely used worldwide. So we jumped on that opportunity in a sense, rather than confuse the population and look at a variety of vaccines and a variety of choices. The World Health Organization has in fact approved most of the vaccines already, which are under emergency use, for use in the pregnant population in different circumstances. For example, if your background levels of COVID are extremely high, if patients are dying, hospitals overwhelmed, you can choose any vaccine you have. But we are privileged here in Trinidad and Tobago at this time to have a very good option to use, which is the mRNA Pfizer vaccine in pregnancy, as well as the Sinopharm in the breastfeeding population. And we can, in fact, we're probably looking at some point in time to look at the rollout of Pfizer in the breastfeeding population. But what I am urging you to do is, if you're eligible for vaccines, take the vaccine that you have in front of you and have it in your arm as soon as possible. Thank you.
So, Richard, I'll take the second part of your question, which was an inquiry as to how we would project hospital beds and make more resources available or reallocate resources given the new variable, which is an increased number of vaccinations. Now, I'd like to start by saying that the Ministry of Health, as you all would be aware, makes decisions based on evidence. And our evidence in the case of the parallel healthcare system and the allocation of resources is based on the World Health Organization data and statistics in terms of the levels of care that a patient requires and the sort of medical care, medication, staffing, resources, and equipment, as well as the local context. And we use the information that we chart daily and which is presented at the media conferences to really look at the reallocation of resources. Yes, I agree with you that we have seen an increase in the vaccination uptick, but we also prefer to be very cautious, and out of an abundance of caution, we tend to continue to manage our hospital bed allocation based on the need. And again, we would have spoken a lot about the supply-demand equation that we are looking at. The trend that we've noticed thus far is that our ward level beds, the occupancy in the ward level beds, tends to be somewhere on or around 40%, and that's been ongoing for about 6 weeks now. However, we continue to see high occupancy levels in the ICU and the HDU beds, and this is where we are reallocating the resources. So we look at several variables when we determine how we are looking at beds. We look at restrictions being relaxed, which result in an increased number of persons commingling, of course, being the major risk factor for persons being at risk or being exposed to COVID-19. We look at the presence of variants, and of course, I would have mentioned that we work very closely with the University of West Indies lab, as well as CARPHA, and to ensure that variants are detected. And we also, of course, look at the clinical status of those patients, which Dr. Trotman looks at. So even though we may be seeing an increasing number of persons being vaccinated, and we hope that this would, based on the evidence, result in less hospitalizations, we still continue to allocate our resources out of caution. And we continue to, at this point in time, we have preparations in place to ensure that the ICU capacity and the high dependency unit capacity, which is where we're seeing the higher levels, can be increased in case of an increased number of cases or a new variant. With this in mind, again, on behalf of my team, I'd like to reiterate the need for vaccination. It is the only way and the only proven way for us to really reduce the number of persons that are accessing in our hospital and reduce the burden on the entire healthcare system. So thank you.
Thank you, Dr. Richards. We go now to Tobago. We go to Radio Tamron. Are we ready with questions from Radio Tamron? Okay, I think we'll try to come back there. Let's go straight then to Power 102.
Good morning.
Oh, hello, Mr. Clark. Yes, we'll stay with Radio Tamron at this point. Please pose your questions.
Yes, Clayton Clark, Radio Tamron. My questions, two of them. The issue of mandatory vaccination is much a talking point in the country. Has there been any discussions on the imposing of a fine on persons who either fail to vaccinate or those who are exposed to the virus or have contracted it? Any sort of fine for them exposing other persons to contracting the virus? And my second question, I'm not sure, I'm not seeing the CMO here today, but I'll ask it nonetheless. Has there been any discussions on the Abdala and the Sputnik vaccines coming to Trinidad and Tobago? If so, can someone just give an update on the status of those two vaccines? Thank you.
So I'll take these two questions. Thank you very much. The topic of mandatory vaccinations continues to be one that is frequently discussed at all levels. And as the Honourable Minister would have indicated, as well as the CMO, this is a policy decision and one involving legislation. So it's a decision that will, if it's required, needs to be taken by the Honourable Prime Minister and the Cabinet. At this point in time, I would like to reiterate that vaccination is voluntary and that we really urge everyone to exercise social, personal, and now civic responsibility in obtaining their vaccine once they are eligible. The second question was about the Abdullah and the Sputnik vaccines. And as the CMO would have been indicating from the onset, the Ministry of Health considers vaccines that are fully EUL or WHO emergency use license approved. And at present, the Ministry of Health and the government has ensured that we have several choices of vaccines that are now available at 109 health centers and several mass vaccination sites across Trinidad and Tobago. So there is the choice of the Pfizer vaccine for persons that are aged 12 and over, pregnant women, healthcare workers, teachers. There's the J&J, Johnson & Johnson, one-dose vaccine. There's the AstraZeneca vaccine that we would have started with and the Sinopharm vaccine. So we are really spoiled for choice in Trinidad and Tobago based on the safety, accessibility and availability of these vaccines. Thank you.
Thank you, Dr. Richards. I like your statement. They're spoiled for choice. We go now to Power 102.
Good morning, Sparkle McIntosh, Power 102 Digital. Both of my questions are for Dr. Abdul Richards. Doctor, a position had been taken to not conduct autopsies on patients who died due to COVID-19. Would that now be revised given that 3 vaccinated persons have died? This is especially since the vaccine is supposed to minimize cases of severe illness and fatality. My second question, much emphasis has been placed on vaccinating the population. However, new information has come about that herd immunity is somewhat of a myth with the Delta variant. This is according to Sir Andrew Pollard. It was shared in a video by the Minister of Health with media personnel. Does this now hinder the objectives of the Ministry of Health and Health authorities? Thank you.
Okay, so I'd like to use this opportunity, and thank you very much for your questions, to reiterate that vaccines are the safe, effective, and sure way of reducing hospitalizations as well as deaths due to COVID-19. And of course, vaccination has been in our system for 40 years plus. And it's our weapon and our response against COVID-19. We've all been vaccinated as children. We'd all recall that. So regarding the vaccination status of persons, CMO would have shared, and I'd like to just remind everyone that 99% of all COVID-19 deaths were in persons who are unvaccinated. 99% of all ICU admissions that we have tracked from July to present are in persons who are not fully vaccinated, and 98% of high dependency unit admissions are in persons who are not vaccinated. We are confident and we are guided by the World Health Organization's evidence, knowledge, and the information provided based on studies that have been conducted on several hundreds of thousands and millions of persons worldwide, that vaccines are safe and effective. Thank you.
Thank you very much, Dr. Richards. Now to TV6, please. Are we ready with TV6?
Good morning, Renessa Cutting, TV6 News.
Wonderful.
My questions are for Dr. Sujisingh. Could you tell us what is the general experience of pregnant women with COVID-19 in this country? Have we seen a higher incidence of these cases progressing maybe to HCU and ICU? And on that note, if you could give us any numbers, any statistics as to if there are any pregnant women in these units. And also, could you tell us generally what is the health status of pregnant women in Trinidad and Tobago? Are we seeing a lot of pregnant women with comorbidities, etc.?
Thank you for that interesting question. Some of it is with respect to general pregnancy care. I'll start with the issues related to some of the statistics. As I said before, we have 383 3 pregnant women, and they're all at various stages of pregnancy since the start of the pandemic. Some of these patients, especially those in the first half of pregnancy, generally were quite well in terms of the numbers. Persons in the second half of pregnancy, those with comorbidities, obesity, diabetes, high blood pressure, asthma, tend to be the ones who may get more ill of the patients we've had so far. Approximately 3% ended up in the HDU or ICU. Most of these would have been in the latter stages of pregnancy. As I said before, we actually had 1 maternal death, and again, condolences go out to her family. This patient was very ill in the later stages of pregnancy, presented with severe respiratory distress, was delivered. Baby was delivered preterm and was successfully taken care of with the teams in the neonatal care units. In terms of additional data and so on, right now we do have some patients who are in the intensive care unit. So, we're not at liberty to share too much more than that. I have some updated figures. Mr. Lawrence Sujisingh from the unit that collects the data gave me some additional data in terms of the vaccines uptake. It's 172 women as of yesterday. So that's good news again. We are looking like we are on target. The number sounds small, but it's a good start. So I'm hoping that we continue to have this good uptake. In terms of the general health of our population, I'm afraid to say that we have approximately a little less than 16,000 patients who deliver on an annual basis. More and more we are seeing patients with health issues. One of the biggest issues we are seeing would be patients who are booking their pregnancies. 40% are waiting till after week 20 to have their first visits. And by not seeking antenatal care, you are missing out on critical care in pregnancy. So we are doing catch up. Having said that, Trinidad and Tobago is still doing very well. We are actually on the world map now since 2016 by having attained what's called the Sustainable Development Targets for the year 2030. When it comes to maternal mortality, we have achieved the targets that are required. We are continuing to do very well, as well as neonatal mortality rates. They are very good as well. They are less than 7 per 1,000 live births. So we're doing well in terms of the outputs, but I'm sure we could do better. Thank you.
Thank you very much, Dr. Sujisingh. And since we're on the topic of vaccination and pregnancy, I just wanted to get from Dr. Suleiman. I know she mentioned some of the mental stress that she had awaiting the vaccine. And to get a sense from her now of her sense of peace, if she has a sense of peace or reduced anxiety since she has been vaccinated at this stage of her pregnancy.
Thank you, Candice. Yes, I mean, I felt a huge sense of relief when I got the vaccine. I know the rest of my family as well, like, felt that sense of relief. As I said, at least now I know if I do become infected with COVID, it will not be severe illness. I will not end up in an ICU on a ventilator. So yes, and people might say it's late in pregnancy. Why are you going now to get the vaccine? But I don't want to go into hospital to deliver, contract COVID there, and then not be able to go home. So at any point in your pregnancy, even if you think it's late on, it will make a difference to get vaccinated.
Thank you very much for that reassurance. We go to CL Communication, please.
Good morning, Natalie Singh, Caribbean Lifestyle Communications. My 2 questions are for Dr. Richards. I was just wondering, what is the uptake of vaccines when it comes to teachers? What's the uptake looking like? And then secondly, did the Ministry of Health meet with the education stakeholders before developing the vaccine strategy for young people and for educators? Thank you.
Okay, thank you very much, Nadaline. Both questions refer to the vaccine deployment plan within the health education, within the education sector. And as per the question regarding the vaccination uptake amongst teachers, I believe that it would be better handled and it should be directed to the Ministry of Education through the relevant departments. The vaccine deployment plan is, of course, one that involves a whole of society and whole of government approach. And for further details on the development of that deployment plan, again, I would direct you to the Ministry of Education. Thank you very much.
Thank you, Dr. Richards. We go to TTT now.
Hi, good morning, everyone. Sonal Lala from TTT News. Question to Dr. Abdul Richards. CARPHA, the Caribbean Public Health Agency, yesterday would have announced that they've taken some mitigation steps as one of their staff members have tested positive for COVID-19. Can you see whether any testing or anything like this would be affected in terms of testing for Trinidad and Tobago in particular? And questions from the public. Some people are saying some concern about persons putting down their masks and smoking in public. Can you see whether this in the regulations is permitted?
Thank you very much, Sunil. So the first question as pertains to CARPHA, of course, the Ministry of Health does have a guideline, and we do have guidelines with respect to testing of persons and contact tracing, and that will be followed at the workplace in CARPHA, as we've been doing since the first case of COVID-19 in March of 2020. The Ministry of Health also, through the Trinidad and Tobago Public Health Laboratory and the RHAs, has several PCR testing sites available throughout our hospitals. So we do not believe that this case will impact on the testing capacity within the country. Of course, even at CARPHA and within the labs, we work together. So there are contingency measures to ensure that work is ongoing. Your second question was about smoking with masks being down. That is a legislative question and one that should be directed to the Office of the Attorney General, given the nature of the question. However, I would like to again take this opportunity to inform everyone and to request that we all wear our masks properly. And of course, removing your mask while smoking is tantamount to not wearing your mask at all. So we do ask, as one of these 3 Ws, to please wear your mask properly, as well as watch your distance and wash your hands. Thank you.
Thank you very much, Dr. Richards. And we go to a quick follow-up from Radio Tamron at this point. Are we ready with Radio Tamron? I think they have a follow-up question at this point.
Hello.
Hi, we can hear you. Please go ahead, Mr. Clark.
Right. My other question, the government has said or has reported or has indicated that the country have been receiving donations of vaccine. Is it that the vaccines were given free of charge, and does the government have to pay for these vaccines?
Thank you. I think Dr. Richards will take this question.
Thank you very much. So as it would have been shared in the public domain by the Honorable Prime Minister and other members of the Cabinet, vaccines have been received as donations. And if you require any further information regarding vaccines that may have been procured or purchased, which there were some being procured and purchased, we would advise that you direct these questions to the Honorable Minister of Health. Thank you very much.
Thank you very much, everyone. We have come to the end of today's media conference. Just full of information today. We got an update on the parallel healthcare system and, of course, a general COVID-19 update. We got an update on COVID-19 vaccination for pregnant and breastfeeding women. And a special treat today, we got a testimonial from Dr. Suleiman, who is a medical doctor, interestingly, an ICU specialist, who's also pregnant, and she took the COVID-19 vaccine herself. I don't know what stronger testimonial could possibly get to encourage our pregnant women who are in their 2nd and 3rd trimester to get the COVID-19 vaccine. hundreds of thousands of women all over the world have gotten the vaccine. We were also reminded that Johnson & Johnson vaccine is available throughout our vaccination sites. That's over 109 health centers throughout the countries, mass vaccination sites, drive-through vaccination sites, and there are community outreach activities happening. Ladies and gentlemen, we have vaccines for you all over the place. We have vaccines for children between the age of 12 and 18. And we have vaccines for the general population. Also encouraging our teachers, we've opened up Pfizer vaccine to you. Healthcare workers, everyone, as we close, I just want to thank you for sharing your time with us. And I hope that this season of National Pride continues until Republic Day, beyond Republic Day. Remember that we can overcome COVID-19 together. So let's do this for ourselves. Let's do this for country. Let's vaccinate TNT.
Hi, Jackie Crosby, comedian, radio talk show host, all-round entertainer. And people ask me, Nikki, why did you get vaccinated? Well, for many reasons. I value my life. I value my husband's life. I value the life of my family and friends. And I am Trinbagonian. Yeah, I miss the beaches and the parties and carnival. And I miss entertaining for kids. I have my reason for vaccinating.